Good afternoon, everyone. Alvin Lindsay. I am the proud Director of Outreach and Counseling for the Fort Valley State University, and honored to be a part of this wonderful delegation where we're going to talk about empowering people to advance HIV care in rural places and spaces. I'm joined today by a delegation of outstanding advocates in the field, Mr. Sincere Lambert, the CEO and President of Evangeline Inc., Ms. Shakira Cheston, who is the project coordinator for Morris Brown College MBC Choice Initiative, Mr. Gregory Harris, a very outspoken advocate in the HIV/AIDS community, empowering others to know more about HIV and AIDS. And certainly we thank Morehouse School of Medicine's team, Ms. Jeree Stroud and Mr. Evan Martin for being on board and really calling us all together for just a natural conversation around how we can better improve services in these disparate communities. And I think there's a power there in togetherness, which is why we have so many different organizations on board representing various levels of capacities, because we need to be able to do the work. I think in beginning this conversation, let's just start from the beginning. I mean, HIV and AIDS in rural communities, as we know, is a disparate epidemic that is disproportionately impacting people of color. How do we as a group, and you all jump in, please, at some point and give us your practical and theoretical knowledge around how we can be better at reaching this population, dealing with issues that may come about on a personal level, interpersonal level, community dynamics, or societal platform, and build the capacity of each of those domains to better be able to address this issue in our community. So at any point, no holds barred, just jump in, let's talk about it.
Okay, perfect. So thank you for teeing up the conversation. Um, to piggyback off of some of the things you said, a lot of my perspective as it pertains to the origin of my work in this field, as well as the origin of my relation to the rural community, started at Fort Valley State University. And so having that firsthand view of access or the lack of access, the different barriers or obstacles that are in place, small things from transportation to larger things like financial means. It did create a lens of making sure that we created spaces of prevention, as we're also intentionally doing an implementation side of helping those who have already had those disparities and shortcomings in the rural areas. For me, I personally feel like a lot of the things that are coming out of rural communities are great. You know, there's great people, great community, great values, great traditions, similar to homecoming, things like that. But a lot of the conversations that aren't being had do pertain to sexual health, mental health, and all of the different intersectional conversations. And so I feel like when it comes to understanding the demographics that are in those areas, it's hard to really meet them where they are, like I tend to do with my work, because of the lack of conversation and the lack of, I don't want to even say initiative, but innovation around the initiatives to make sure that people not only have the awareness of it, but have the access to it, and then have the education to go forth and share that with each other. Because like you've taught me under your guidance at Fort Valley State University, that the work isn't done after you have your session or your testing event or your screening or you do your reports. It goes further. And so it's an efficiency and effectiveness issue. And I feel like a lot of what's going to come out of this conversation should definitely come from a place of regulating the conversation as well as regulating the visibility of it and proximity of it.
Awesome, thank you.
Okay, so can everybody hear me?
Yes.
Okay, perfect. So I totally agree with Shakira on this. But one of my largest stance is the stigma as a whole when it comes down to BIPOC people, Black, Indigenous people of color. We have a stigma within our communities that is just completely against disease. We're ashamed of disease. We hide disease. And that's across the board. Even when there's someone who passes away within your family and they passed away of cancer or any other type of debilitating disease, we hide it. We whisper about it and we're ashamed. And this is very much the same when it comes down to HIV and AIDS and STIs. All of those stigmas are placed upon our community. So it makes us shame to even seek out care. It makes us shame to even speak to our care providers of these things. And so that's one of the biggest things that we need to work on within ourselves, work on within our communities, and providing those mental health capacity classes and building to where people become comfortable within themselves to understand that this is something that happens, but it's also something that you can defeat as long as you stand within yourself and understand that we as a people are resilient. And there's no need to be fearful of something that you can overcome. And when it comes down to HIV and AIDS, it's a stigma that has been long going. And at this point of where we're at, when it comes down to care and prevention, we have to educate ourselves and grow from it and become aware that it's not something to be fearful of, but it's something that you have to have a respect for. And you have to continue in that respect and make sure that you're taking care of yourself or protecting yourself, wherever you lie on that line. And so my work in the rural communities, I'm seeing, especially where Evangeline locates, where we're operating, we don't have care. We don't have preventative care. You have one office that takes care of the whole area. And it's one of those things where we also have to learn to do things in our own community to protect ourselves and teach ourselves and grow. For even like for my personal, with my primary care physician years back when I talked to him about PrEP, he had no clue what it was. But he was willing to have that conversation. He was willing to educate himself, and he was willing to write that prescription after he educated himself on that. So we also have to take accountability for our own selves and say, hey, I'm going to be an adult and have this conversation with my primary care. And if you don't feel comfortable with having that conversation with your primary care doctor, if you have one, then why are they your primary care doctor? So we do have to ask those questions as well. And then for those people who don't have insurance and don't have the financial means to be able to handle those things, we have to build structures to where we're able to support each other in that way as well, because it's still an epidemic. It's still something that needs to be grasped and taken in hand. Just grab the bull by the horns and really get in there and take this initiative to do something about it.
So what would you to the point of the stick? So at the top end, you mentioned stigmas, and that is a very big prevalent thing, not only just in the community of prevention work, but in its community as a whole. What would you say would be the best space to start dispelling those outside of educational material and trainings and presentations? Like, what do you think would be a more practical, in-depth, honest opportunity to really get the truth out there, as well as get them to understand the severity of the decisions that are being made on a day-to-day basis?
So for me, I think what it really is just general conversations. We have to stop whispering. We have to stop being scared to tell people what's going on. And it may not even be about yourself, but we as people of color, we will definitely not mention that grandma is sick. She's just not doing well. When it may need to be a conversation of, grandma has some things going on that can affect a lot of people. With my organization, we do a lot of work with lupus. Lupus is definitely a secretive disease that for some reason people mention it, but they won't tell how it affects you. And even in this work, when it comes down to HIV care, a lot of people don't know that if you have lupus, you can actually come up with a positive testing for HIV. They're direct. They coincide with each other. So it can also give you a false negative. So it's one of those things where we really need to start educating ourselves on what affects us. And back to your question, when it comes down to stigma, it's truly just the conversations. Especially we have a vast technology in today's world. People live their lives on social media, but how often do you see people posting about, hey, have you went and got tested today? Or, hey, there is a clinic that has just recently opened that's doing free testing and just things of those natures. We don't we don't post about things that are more important to life than sharing a funny video. Laughter is also good, but at the same time, your health is as well.
Yeah, I could echo on that, Sincere. It really is about expanding those conversations. And I'm going to pause on my comment because I think I heard Greg trying to come in. Greg, were you saying something?
So we're trying to figure out how to start a support group and how would that look. So I'm actually partnering with the Hope Center. I'm waiting on an email so that I could address those barriers or find out if there are any other barriers that we could address and partner with them to get that key component back to the Hope Center.
Wow. So in hearing that, what comes to my mind immediately is that catchphrase, nothing about me without me. And I think that there need to be several conversations happening simultaneously. Conversations where there is actually direct care for individuals living with HIV and AIDS that include the voice of those living with HIV and AIDS to identify what those barriers are in terms of services, be it transportation, be it economics, be it mental health. I think that in the African American community, one of our largest mobilizers of change has always been our African American churches. I remember the NAACP had a wonderful initiative, the Black Church and HIV, where they were training pastors how to incorporate these conversations within their daily messages on Sundays. Again, though, they have to be present in the room. Again, nothing about me without me. We have to kind of look at how we can really have these intentional dialogues, not only within ourselves, but also within our relationships. Because I think that what happens is we start to identify what those missing elements are in the sense of our communities and how they're formed. I'm hearing there are no natural spaces and places for people to actually engage. There are really a lot of supportive African American churches who welcome you into the congregation beyond certain designated roles within a church. I'm hearing that we are providing treatments in many cases without really having a full understanding of the impact and talking to those who are living with. So we have to X out this whole either objectification or alienation of voices. So what are some ways that you think that we can kind of break this silence? I mean, I think my last stat I saw was that people that were that had AIDS had suicidal ideations, or actually not committing, but completing the act of suicide. It's not a crime, at 7 times higher than any other rate. So we see that we are suffering in silence, and that designates, in my mind, not having a voice. So what are some ways do you think that we all can help elevate the voices of those living with? I know that Hope Center has the community advisory board. I'm hoping that still continues, and I'm sure that's going to continue when they identify their new leadership. But what are some ways that we, being entrenched in the field, can provide some key guidance to those that may have influence over a few more resources than we are, and can invest them well in solving this issue in our communities? Are the people that we need to engage in this conversation obviously people living with, but are there others that need to hear this more so than others?
I'll go ahead. Go ahead.
Okay. So I do believe that one of the things that we really need to work on is our communications across the board when it comes down to this epidemic. Thank you, Greg, for mentioning the Hope Center. But at the same time, Hope is just a small portion of this. And it's NOMO is a great organization. They do a lot of work, especially when it comes down to trans organizations. My organization, Evangeline Inc., we have partnered together and created a larger organization, Unity of Color and Alliance. And that organization with GPS, 3 organizations have formed this. And we're welcoming other organizations to the conversation of what we can do as a collective, because not only we can't just lean on Hope to fix the problem, because you still have other disparate counties that are not being serviced. You know, Hope is making bib, but people in Warner Robins, Fort Valley, Perry, they don't have cars to make it to Hope.
Mhm.
So even though Hope moved and it may have caused the issue within Macon Bibb, what about the other areas? So it's still a much larger conversation that needs to be had. And we're actually UCA is actually moving into our office in a couple of weeks. And once we get into that office, we're going to start reaching out to Hope and anyone else that we can just make the noise to get the rural areas seen. Reaching out to those big pharma companies that are doing the work as well. And so those are the things, bringing those ambassadors down from the metro Atlanta area, getting them down here to see that there is a need. A lot of people don't even remember in this particular area in 2008 that they actually had a PrEP center here. Who remembers that? Majority of the people that I've spoke to here never knew that there was a PrEP center in this area to even receive PrEP. And now you have people who still don't even know what PrEP is, what is the purpose, what does it do? They have no clue about doxypep and things of that nature. And you still have other diseases, STIs, that's running rampant. Syphilis is running wild in the state of Georgia. So those conversations, we have to sometimes take in the complaints, but listen to the complaint to learn how can you pivot to better the situation. What can we do to assist Hope? Hope may just have lost their current initiative because of the move, and they have no way of access to actually create those peer groups. So bravo to you, Greg, for being one of those ones to reach out to actually say, hey, this is something that is needed, that peer-to-peer conversation. And UCA is definitely willing to provide you all with the space to have that conversation and be able to invite those people. And we're making partnerships with transportation organizations in the area to be able to transport people to the meeting, meet people where they're at. We have so many different functions going on in Middle Georgia, but who's there having the conversations?
And I dare say, and I dare say the Hope Center has done an excellent job with that. They were the nucleus of a lot of this inductively led change, where voices were heard, thus their establishment of the CAB board. Transitions are transitions, and as they grow, but again, they are only part of a larger body where this discussion needs to be heard. I think about they say the 4 key groups in organizing an effective team are those who are most impacted by the issue, topic experts, those who can actually compile this discussion into a legible translation, and lastly, those who have resources. When you put those individuals in the room, then change can happen. So for me, it's not approaching the work siloed, but creating these spaces with all of these different levels of players can hear one thing as led by those who are most impacted by it. Hope Center has learned how to become a one-stop shop, providing housing and counseling and food. I think there are lessons to be learned from that, because what we understand about HIV and any other health issue is that it does not happen microscopically, but it happens on a macro level. If a person is without housing, their concern is housing, not getting into a regimen of care. If a person doesn't have a job, their concern is not going to be how many pills I have per se, if I even have the pills, but how do I make myself marketable to get a job? So we have to understand that there is an intersectional approach that has to happen. And once we find those champions, such as Hope Center has been in the past, and currently will be with their new leadership and continued work of Mr. Easom, we have got to get individuals in the same space, removing all thoughts of, I have the answer, blank the slate out, and come in and really hear what's going on. And I think that in rural communities where there's such either there are no or disconnected resources in all of those areas, it's time that we understand that there is power in what Sincere said earlier, which is coming aboard and being more interagency in approach and seeing what's the strength of this organization versus what's the strength of this organization, and then telling a full story and pulling together a full array of services. So I think for us to start this conversation, hopefully others will join to do that asset mapping of topic, expertise, leadership, resources, be it financial or non-financial, or in many cases, simply a desire to be involved is the biggest resource with this population. But how do we go about, who do we lean to have these conversations, to start them off and really initiate this whole mobilization process?
And so for me, because a lot of good questions came to my head while y'all were talking. For me, I am on the younger spectrum of this conversation. I just turned 27 on Sunday, and my passion for this work supersedes a lot of my peers. And so similar to what we were saying from Mr. Lambert going the general conversation to Mr. Lindsay going the 4 pillars of making sure that the conversation is congruent, leaning on that younger generation as well as those long-term survivors and creating a space for them to not only get rid of the language barrier, because there is a language barrier. We can't talk about HIV and the epidemic of HIV without talking about how it intersects with LGBTQIA allyship, all of the different terminology that's changed over the time, progressiveness, all of the things. I feel like leaning on those two and creating a space for them to not only understand the purpose, but understand the passion and also understand some of the heavy lifting, like you're all mentioning, like the Hope Center and a lot of the different organizations such as Sister Love and organizations that have really put their foot on the necks of trying to really lower as much as possible over the years. Dating back to the 90s. So getting the younger generation to understand why it's so necessary as it pertains to our future, and also why it's necessary for the long-term survivors to know that they can pass the baton over and have somewhat of gladiators in a place wanting to actually do the work. Because I will say AHF and AIDS Atlanta and things, organizations like that, they have been doing a good job of like the walks and the 5Ks and the different events to get the visibility and the community aspect out there, but also creating a space for roundtable talks similar to this, but with a space for them to understand the truth. And after they understand the truth, the real prevention measures, the real behind the scenes outside of the TikToks and the one pagers and the newsletters, getting them to fully understand that this is a real thing that will not go away if we do not care about it and put it under the microscope in real life. So as it pertains to starting the conversation, I would definitely say keeping it there with those two communities while also making sure that attitude is also a big one. In the rural community, I've had a personal experience of going to the Department of Health and it being very cold and very rigid and sometimes being a little scary. Not every time, but Southern hospitality has not maintained its grit over the years. And I can completely understand, because in this work, you can get burnt out and you can get frustrated. No one is saying that you have to be perky all the time, but in order to get in front of it and in order to be personable and create those parasocial relationships with other people, similar to what you said, Mr. Lambert, word of mouth. So if Shakira goes to, let's just say the Hope Center, Shakira goes to the Hope Center, she looks into DoxyPep and or PrEP, and I have a great experience, they give me a goodie bag, it's have a great day, I will have no issue posting it either on social media or telling a friend to tell a friend, going back to my campus, going back to my job. So I feel like attitude plays a big part too, because getting people in the room is already hard enough. And then once we get them in the room, now it's give me your arm. Let me see this. When the last time you did that? Funny looks, different verbal and nonverbal mannerisms that are associated with this work. The four of us, we completely understand, and we come at it with an energy that's very, we have to get this done, guys. Like, hey, but some people don't have that same passion, and because we're not in every room, that's where some of that fall off and some of that slack could be coming from. Because, like you mentioned, Mr. Lindsay, some people are worried about jobs, some people are worried about housing, some people are worried about children. I'm a mother myself, and I can completely attest to the fact that going to the doctor or making sure my daughter has clothes from school. So when creating these conversations, we definitely want to make sure that we're looking at the people that we're appointing, not only from a clinical side, but from a pre and post standpoint of making sure that they have the type of ability to create and hold relationships as it pertains to capacity building with patients, whether they have the diagnosis or not. If that makes sense.
A lot of sense. I love that. It's capacity building, not incapacity building. And I do believe that you're absolutely correct. In many cases, when people muster up the courage to step into those spaces of help and they're not received in a positive light, it totally changes their trajectory from growth to decline. How do we model and build those relationships of strength where everyone feels involved? Sincere, you have any thoughts?
I think we need to continue the work, continue meeting people where they're at, and formulate programs around where they're at. One of the things that I've recently, well, not really recently, but over the last year or so, have realized that within, even like Georgia, for instance, within the Georgia foster care facility, I sit on the board of trustees for a foster care facility. And my facility houses young men from the ages of 12 all the way to 21 years old. They can stay in the program after they've turned 18, for we can help them transition into independent life. But a lot of those kids come to us who have never been tested, but they're sexually active. They have no clue, no education on these pathways of what's going on. And so we've worked with trying to build different things, providing them with services, providing them with programs to allow them to have this education. So going back to what Shakira said, when it comes down to the youth, there is a very, very large disconnect with them. And so because of the fact that it's still an epidemic, but it's not as pounding as it was when I was a youth. When I was a youth, it was almost on every corner, every TV, every radio station. Everybody was talking about it. So even as a young teenager, it was something I was aware of, which now, because of the table has turned and the medications that are provided and the care that is provided, we've kind of turned away from prevention and kind of led more into care, which is nothing wrong with that, but we also need to rope back in prevention. So we do need to have those conversations and bring prevention, especially to the youth, because it's super important that we don't forget where we came from to continue on the pathway of healing and being better. And if we want to annihilate permanently, we have to continue to grow on both sides, care and prevention. We can't leave one behind. We can't say we're going to do prevention and leave care behind and then have care and leave prevention. They work together. They're twins. They have to stay together, dress together. So we want them to look good. We need to make sure that they work together to continue to be able to annihilate this whole situation and make people understand that you're okay. It's okay to have a problem. It's okay to not want to deal with this today, but have the capacity to work yourself up to be able to have these conversations. Have the strength to deal with what you're facing or what your friend is facing, family member. We have to learn to start supporting each other when we have that capacity, but you got to build the capacity to have the capacity. So, and that's within yourself. So you have to say, okay, today I can't deal with this, but tomorrow I'll try to peek into it. And I'll try to look more the next day, the next day, the next day, until I'm able to handle what I'm facing.
Absolutely. Absolutely. Were we able to recapture Greg's thoughts around anything that he's heard? Are you able to unmute, Greg? Technology is a wonderful thing. But we'll make sure that we include his thoughts within this process. And I think we're hearing a lot of great things. So we're hearing a lot of things that are tangible that we need to work on, built spaces, resources, and we're also hearing intangible directions, which is simply, in many cases, just a simple act of caring, understanding and really living our whole concepts around diversity, equity, and inclusion, and understanding that that goes beyond race. But it also goes to other areas of our lives where we are presenting with issues that may be different than someone else. And we won't even call them issues, but opportunities for conversations and community be built. So I think that as we talk about empowering people to advance HIV care in rural places and spaces, it does start with these as open conversations where we are feeling safe, we're able to express, we want to express, making sure that everyone is acknowledged in his or her thoughts around the issue, and giving everyone the grace of just being present. And I would not just simply say present, but participating, because I can be present, but still not a participant. So today, again, and Greg just texted, he is having technical difficulties, but I know him well. He has been an advocate now for individuals living with HIV for the longest, and he's all about removing those barriers simply to being present, being heard, being recognized, and feeling as valued as anyone else in the room. I think that this conversation today, let's talk about it, empowering people to advance HIV care in rural places and spaces, truly starts with this. So again, thank you, Shakira, for joining us, Ms. Cheston and Morris Brown College, Evangeline Inc., Sincere Lambert, your leadership, may it continue to grow. Certainly Greg, who just sent me a text, and he wanted to say that the language, that's a good point. Instead of you having it saying, I'm living with it, very good. So he's saying that as opposed to saying, I have HIV, say, I'm living with HIV, because at the end of the day, that's what it's about. Thank you, Greg. We are living with this epidemic in our communities. So I want to thank Morehouse School of Medicine for engaging in this conversation, as an institution is known to do in our communities of color, always standing on empowerment. And I thank all for joining us today. And stay tuned. So as we talk about it, I think pretty soon we're going to be about it. Have a blessed day.